Well, hi, everybody. It's Leo Sarkissian. We're going to start on time, I guess, and people are still coming on, Carrie, but I'm assuming that's okay.
Oh, that's fine. Yeah. So I just wanted to welcome everybody to our webinar today with Leo, and he's going to be talking about pressing issues for people with disabilities and their families across the state of Massachusetts. So Leo's been doing group meetings throughout the state, and if you haven't been able to make one of those meetings, you're going to hear about it all today. So before we begin, I just want to make sure everybody's okay and you can hear us all right. And we typically take questions at the last 15 minutes. So if you want to chat into me and let me know if you can hear us okay, and just practice using the chat pane. You can just say hi. Okay, you have all been muted upon entry, and the reason why we do that is because we record each session and put it up on our YouTube channel at the end of the session. So it looks like everybody's okay. So at this point, why don't you take it away, Leo?
Sounds good. Hi, everybody. Glad to be with you today. And I'm looking forward to this conversation. It's a little different when you're on Zoom. It's not the same as being in a room with people, but we will have plenty of time to talk, especially if I move through this quickly. What I do in the beginning, for those of you that don't know the ARC of Massachusetts, I try to tell you a little bit about us and the work we do in government affairs. And some people are missing. Carrie's missing here, and Ellen Taverna. Carrie's been obviously a very active leader in supporting families campaign. She's our director of education and outreach. We got a reverse there on the slide. Ellen Taverna, who's policy officer, works as part-time at the ARC and is an important part of the infrastructure here and communication coordination that we do at a statewide level. We're lucky to have a lot of volunteers and families and affiliates and some non-affiliates who work very closely with us, but without staff knitting that together, we'd be in trouble. And Maura Sullivan's the director of government affairs, and Charlie Fisk, also part-time, is director of public policy, and they are just wonderful people to work with. And I'm pleased that we have such individuals to help knit what we do together effectively. And then in the nation's capital, we have the ARC of the United States. And one of the pictures you see there above is the team. And Julie Ward is on the other side of one of our colleagues, Julie Koppenrath. She's the fourth person next to the person with, I don't know if it's a flowery outfit. Julie's now head of the government affairs office. And at the ARC, she's the third one we've had in the 50 plus years of having a government affairs office in DC. There's only been two previous leaders of that office. And Nicole Jorwick is shown there, and Marty Ford, the person who recently stepped down. I'm forgetting Clear's last name, which is embarrassing because she is doing an awesome job with mobilization. And then in the picture below, you see Marty Ford, who's again the previous leader of our government affairs work with former Attorney General and former President Barack Obama. In terms of what we've been doing in the state recently, we've been advocating pretty hard on a number of areas. And one of the questions someone asked me this morning before I got it to the office, I was at a meeting, small meeting with two people. How do you decide on how to prioritize? And we have a steering committee on policy and advocacy, and we have a board that ratifies those things. But we get a lot of input across the year. Affiliates play a role, sponsor members, families from all over. And really the decision to make the workforce the number one priority began 2 Januaries ago from families talking about how tough it was, and then hearing affiliates at the same time saying how terrible it was out there. And that was pretty much echoed across the service system. In terms of our history, in terms of effectiveness, the 2000s, still now feeling like ancient history. We had 2 settlements we were actively involved in, the Boulay waiting list case that was court decided, and then the Roland nursing home case, which had 2 lives and Center for Public Representation led on that, supported DLC and the ARC and others. I think Stavros, Independent Living Center, was part of Roland. Boulay case, of course, had Neil McKittrick leading two associates, and the ARC was a client on that case. And then our Attorney 22 advocacy was laced into that and separately. But the only other settlement I don't note here is one that actually Governor Weld wanted us to sue him for, and that was to phase out some of the state institutions. And that's something, it's still in play and in process. In 2014, we were very excited to see some awesome bills pass. And the first time in a long time that we saw 3 major bills pass in one session. And that was the Autism Omnibus Bill, the Real Lives Bill for Self-Directed Services, and the Federal Corey Bill, which is a background check, using federal background check. And then 2016 had the first multi-million-dollar jump in family support. 2017 to 2020 now, we've hopefully have established a new formula for turning 22, tripling to meet the high number of students graduating every year. And then this year, a great Baker initiative that has been embraced by the House is the rise in 61% or $4 million in the DESC DDS program, which helps youth stay at home. Sometimes they are able to stay in their school district. Sometimes they're in a separate day school, but it's usually talking about young people with significant acute behavioral difficulties, and these funds help them stay at home. So we're really pleased that our advocacy in this area was heard, and hopefully the Senate will embrace it too. We'll talk about the budget. This is really a 3-part piece. One is going to be about the budget, then the workforce, and then we're going to talk about bias. And we're really happy about the Advocacy Alliance that Kerry and Ellen Taverna helped lead. I guess the Becker Center, they helped lead. Kerry supervised Herb Cabral and the newly hired Kathleen Amaral. I'm really excited. And here you see a picture of our friends, families, and leaders on Nikki's Law from the work we did during the informal session. And it includes Representative Campbell in there. I can't see Senator Moore, but he was very active, obviously. And then the Joyce family and the Chan family, Nikki being Nikki Chan. Dana's Law, initially named after the Joyce family in Dana, also experienced significant abuse. And these 2 groups are working as one. And we will have a hearing tomorrow for the registry bill, which has had some revisions, made it a better bill, and we're looking forward to it. The Advocacy Alliance works at building regional groups, and we're hoping folks will also share their stories, and Herb and Kathleen have been working on that as well. So anyway, we have a lot of competition. There's really good things out there that need funding, whether it's cities and towns, public education, higher education, public safety, transportation, and healthcare. So without our advocacy and your advocacy working together across the state, we have to compete. We don't want to hurt any other group. We just want to be right up there and make sure we're prioritized along with other important supports. And then here's a little bit of the public relations stuff we're doing. I'm gonna go through it really quickly, but this is our board president with their son, Sam, and really a focus on how it's so important for people to appreciate what families do, not only for themselves, but for others, and how there's great possibilities for young people with disabilities. And Sam reflects really what a wonderful life people can have, and how important resources are and services to make sure that happens. So we've been, again, pushing the workforce, and it's been a #1 priority, but again, being considerate of the 1 hour we have together, I want to keep moving. So the legislature and the state budget, I want you to be familiar with the leadership of the legislature. I think it's really helpful to get a sense of that. And we actually have a brand new leader of the Senate in the past year. That's Senator Karen Spilka. She has a track record in the House and Senate of supporting our policy priorities and your policy priorities. And her earliest effort, I remember back when she was in the House, was around DDS eligibility, when people were being really basically, it was a whole issue over the IQ, and it was being done in such a way that we didn't agree with. We thought it wasn't in line with not only statute, but it wasn't in line with best practices. So people, if they were at 70 or 72 IQ, despite their functional limitations, they were being, basically said, sorry, you're not eligible, you're 72 number. That's really not the way it's supposed to be applied. But anyway, so Karen was big time on that Senate president. And then Speaker of the House, Robert DeLeo, in his first term, as early as his first term, which is over 20 years ago now, probably 28 years ago, he fought for maximum feasible benefit. And for those of you that have been around as long as I have, you know how important that was for special education. We lost that fight in the second round, but won it in the first round. But he's also been a wonderful leader on our issues for decades. And I think this year's budget in the House that actually we'll talk about in a few minutes reflects that. Just how great a friend he is. So we're lucky. I don't want to, tell you we can guarantee we're going to get everything we want. We're not, because these are leaders of the whole state and they need to take into account the big picture. But I do think we have friends and that are, true friends in these leadership positions. And then the chief budget policymakers, they're brand new, both of them. So that's pretty wild. We've been fortunate that, again, we know Senator Michael Rodrigues. He has been someone we've met with. His staff, his long-term staff, has been someone that our team has met with regularly. And he happens to right now be a lead Senate sponsor on a higher education bill for people with intellectual and developmental disabilities. So that's good news. He and Senator Lovely are co-leads on that bill in higher education. And then Representative Aaron Miklowitz is the new chair of the House Committee on Ways and Means. And he is a co-sponsor of a bill that provides new employment opportunities for people with disabilities. So that's good news. We got to meet with him a few weeks ago for the first time in his new role. He was very generous with his time. And again, given the outcome in the House, we couldn't, be more pleased with that. But these are people who are going to get to know us better. Senator Rodrigues does know people in the district with disabilities, does know organizations. And hopefully those of you in Representative Miklowitz's district will reach out to him as well and thank him, but also get to know him. These are the people, they'll play a major role. In addition, there's the majority leaders in both branches that are important, and on another time we'll share about them. One of them being a longtime majority leader was Ron Mariano in the House. And both majority leaders are supportive on our issues as well. So what happens every year? Every year it's a dance in terms of what we have to do in terms of advocating for a piece of that pie that's limited. It's not infinite. And in 2009, 630 students turned 22. In 2019, that number is 1,073. And then I break it out with you. These aren't hard and firm numbers. They may change a little bit as the year goes on. But right now, the funding, that shows you why we needed a hike in funding 3 years ago and why that formula to stay stable is so key. And it's $25 million, which is not a little bit of money. It's significant investment in our constituents. But meanwhile, there's new people coming in, but there's people that are already being served, or there's people that are living at home with family that may need new services, right? And if you think about it, we haven't had new money for that in ages, for people that may be at home with family who maybe have new needs, or the family needs funding because a family can't do the things they could do before because of their age. So each year, the challenge is to serve new people while addressing evolving needs. And that includes new medical conditions and other costs at existing services, let alone making sure we can have more money freed up for people who want to do self-direction and craft other roadways, pathways. This gives you a sense of how big, how many line items there are in the budget. Look at it. Respite and family support, DSC that I referenced before. Look at I'm showing you the governor's budget and as a vehicle in that. And then we're going to show you the House budget. When the governor gives his budget, it's really a proposal. It's a blueprint. At the end of the day, the House and Senate make up the budget for the state. So it's not a given that what he says is going to happen. They do meet frequently, so there may be some discussion But as you know, it's not a given. Um, but again, this year, clearly we were able to see most of this hold true. The turning 22, it used to be 7.5 million, that line item 2 years ago. So it's significant that from 2017, 2018 on, it's significant investment that reflects the 1,000 plus students. Community day work. Um, in 2019, it was 210.7 million. It's projected to grow to 232.8 million. So you get a sense. And the biggest one is community residential. And that's really for two reasons. There's a 250 or 240 people that are going to get residential services that most of them are already in 24/7 settings due to a variety of reasons. However, as I said, there hasn't been money to address unmet needs. There hasn't been money to address people living at home, older people, older caregiver issues. And so there's a considerable investment there too. If you look at the numbers, um, this exceeds the turning 22 allocation. And then by tens of millions to address the fact that, we haven't been able to serve folks that have unmet needs for a long time. And then transportation received a boost. But you see the different line items. Autism Omnibus, which is for people with Prader-Willi as well, and Smith-Magenis syndrome, but it's for those with developmental disabilities, but not intellectual disabilities, who also have autism. And then you see some other uh, programs, state-operated homes. Both there's community residential, which reflects private providers, and then there's the state-operated homes, which is basically um, state employees delivering those services, and then service coordination administration and the state schools, which still are considerable. So as you can see, part of the budget, over $100 million. And at some point, um, there'll be a question, right, about the state schools because people are not going into them. If they are, they're in very, very, very small numbers, and it's waiting for a community option. Mass health is down there. It's hard for me it's an entitlement. So really tracking the budget can be very confusing because it includes so many different things. The other piece you see is the Massachusetts Inclusive Concurrent Education Program, which is also related to the bill I mentioned earlier about higher education. Well, here's the remarkable news in the House budget, the House Ways and Means, and then reinforced in the House budget. It says H1, disregard that H1, but basically, if you look at it, they took the governor's budget and they added money to it. They added $10 million to the governor's 7.7% increase. And just to put in perspective that this year is a special year, as a rule, if our budget is increased 3 to 4%, we're impressed because it's such a large budget. But of course, it doesn't keep up with the need, which is why Secretary Sutters, Governor Baker made this 7.7%. They know it's been years without addressing some unmet needs in residential. We're also going to need to do some more work, obviously, with day and work as well. The House added, as you can see, if you look at the governor's budget, it was 232.8 million for employment, and the House added about 3.4 million to his allocation. So they did know that we were concerned. There's still more work to be done in the transition from shelter workshop to community-based day supports and employment, and they recognized that, so they added that money as well. And so they added money in respite care, family support. They added money in community day work, and Autism Omnibus received funding, which is, obviously a big deal. So if you look at those numbers, and then we'll have a new fact sheet out. We didn't have a chance to share the entire breakout, but 10 million in addition to the 7.7 million. So again, a big thank you to House members. And so it's been very responsive in terms of the needs. So before I go to the workforce, just we can talk about this. If you have questions, say them for the last 15 minutes. And if you have questions about the budget, we can talk about it at that point. The workforce. Wow. We did some sessions on this last fall where we were looking for input from families and organizations. And this is a mini piece on the workforce. And just to highlight the significance of the problem, the ARC believes that we have to address the entire workforce problem, that we can't just address the issue from the point of view of provider homes alone or provider day programs. It will also have to look at families that need staff for respite care, or a person with a disability who needs staff for his or her self-direction supports, right? So we have to look at the whole picture. That includes the personal care attendant program. It includes looking at continuous nursing, where people rely on continuous nursing to keep their child or adult with significant medical condition at home. So we want to, look at the whole picture. We don't want to just slice this pie up in pieces. Across the country, there's a significant problem, and some of the statistics we use are both from national sources and state sources. 92% of caregivers indicated difficulty with finding direct support professionals in the recent FIND survey. That's a survey that the ARC of the United States conducted most recently in 2017 with the University of Minnesota Institute on Community Inclusion. And basically, Institute on Community Integration. And, here's a great example. I mean, it's 55% of 60% of people having significant problems. They have 3 or more work impacts. 55% of them had to cut back on hours. 30% of them turned down career opportunities. Okay. I don't think, think about that. 33% turned down a promotion. The 91% going to work late, leaving early, taking off time during the day. That's no surprise, right? That's a given if you have a loved one at home that you're supporting. So what the average family experience is during, the childhood years continue for many families, not for all, who have adults with disabilities at home or teens with disabilities at home. And we need to be sensitive to that, and we need to have solutions in this high-paced society. Massachusetts unemployment rate continues to remain low. It's 3.3%. Functionally, it's even lower than that, because that probably assumes some people who don't want to work in that 3.3% number. The mean wages of our direct support professionals are below those of janitors, clerks, and others, according to the Bureau of Labor statistics. And for example, in the Bureau of Labor Statistics, BLS for short, they basically say janitor custodian doesn't require any degree. And this rate is about $3 higher than the average rate in the state right now for people funded through DDS, direct support professional. The PCA, they have funding at $15 an hour, okay, right now. File clerk, high school degrees required. They're making $17.53. And again, this is a snapshot. These rates probably higher today than they were when we took the snapshot last year doing the research. The annual national turnover rate in programs in the workforce is estimated at 46%. And then to add insult to injury, Massachusetts is the 3rd highest costly state to live in. So that means, yes, we have a workforce problem on one end, and then we also have economic, how do we live here, problem on the other end. And I don't think I need to get into detail with those of you on this call about what direct support professionals do, whether it's activities of daily living or building bridges to community, helping with banking, administering medication. Obviously, it takes specialized training. When that training doesn't happen, that's when we have problems. But we also, in our plan, in addition to having a wider goal, we also are concerned about clinical and professional staff roles. We think direct support professionals not only need to get paid more, and we have to have strategies in that area, but we also think they should get the kind of consultation they need around medical issues and other issues that we shouldn't be taking those for granted. And we think also consultation of families should happen as well, once they're taking care of their loved ones at home. So our plan, and you can look it up at thearcofmass.org/workforce, includes 4 elements that I'm going to go into now. Workforce investment, innovation and system design, clinical teams and trained staff, and building human capital. And you see the website, and I'm sure PDF of this will be available later for you, that you can see the workforce link. Basically, our goal in the bill has been filed in the legislature be for $17 an hour jump right now in FY20. We think we need to do something aggressive immediately. The legislature has voted to raise minimum wage up to $15 an hour. We do think, obviously our salaries not only should be above minimum wage, but above some of those other salaries we noted. We also think if you're going to fix this problem in terms of the entry-level salary, we also need to make sure those with experience and managers and others, clinical staff, get some kind of increment as well to address what's called compression. In other words, John Smith just started at the job. He or she's making $15, $16, $17 an hour. Clearly, someone who's been at the job for 5 years, there should be accommodations to pay them more, reflecting that experience. And then we strongly believe in certain employee benefits beyond, healthcare and related benefits that should be there, such as tuition loan forgiveness, room and board, childcare, retail discounts. Imagine if we told college students that we wanted to hire, that they could have their entire loan forgiven in 10 years, but stay for 10 years, working in human services or disability services. Wouldn't that be pretty attractive? Okay, so these are the kinds of things to think about. Strategy 2 is all about innovation and system design. And that means for us to be able to raise the workforce salaries, we also have to think of cost-effective strategies in service delivery, okay? And individuals and families first, offer packages to maintain family life while addressing adult needs. What can we do for those families, and there's plenty of them today that still have an adult loved one at home, to make that a more effective lifestyle, more supports available, but also means delaying the need for more costly residential services in the long run. What can we do about making sure people get some employment and more independent living skills so they don't need 6 hours, 7 hours a day of day programs, which the 6-hour day is too short anyway. If anyone's got a reasonable working job and your son or daughter, adult son or daughter, can't be home alone. What can we do about after-school programs? It's really all or nothing, as one parent said to me, whose son entered residential school. I wasn't offered anything between the 6 hours and 24/7. And that's what we need to be thinking about. Provide care management. If families are, handling care and hiring staff, let's not just, listen to them when they're going through a tough time recruiting staff. Let's make sure they get support and assistance in recruiting staff. The continued transition from institution to community, of course, and implementing technology for individual advancement, service system improvements. Clearly, if you can go and you have trouble speaking, but you can use your phone to order a coffee or order a Coke or order a green tea, you're going to feel more independent. You're going to feel good about yourself, and that just enhances your sense of independence. So there's so much we could do. There's many more recommendations. This is the abridged version, several more recommendations. And again, you can see it at arcmass.org workforce, as it says right here. The lack of clinical and specialist teams. When the steering committee worked on these issues, we really felt like, the chair, Janarico, and others felt like this is really important to tackle this, because just paying people better, help making sure they have some training, isn't enough when there's more challenging situations, whether it's medical, behavioral, or how to help better teach someone to do something. So there's 3 areas. Chris Fox worked up a nice addendum. He's a former psychologist. He's actually still a psychologist, but he's retired and doing more consultation and pro bono work. He wrote this addendum and basically ensure adequate 5 regional consulting teams across the state. Support families and agencies to manage urgent needs in complex situations. Also, we have to take care of the fact that so many practitioners in the general community don't understand our population, aren't prepared. So we need to have communication consultation for medical, behavioral, dental, or other issues. And ARC's Operation House Call is a great example of a training program. And then specialist utilization. Sometimes in a crisis, whatever, maybe you can use telehealth to see on the screen what's going on, or a live visit to address urgent care or prevent unnecessary emergency room visits. I was given some statistics from DDS, and I don't have it in my fingerprints right now. But I mean, in my, close to my fingerprints. I'm thinking of background checks, I guess. But there was hundreds of unanticipated or unscheduled visits, emergency rooms. So I think, or hospitalizations, and I think that's something that we could do a better job around, because nobody wants to be in a medical setting if they don't have to be. And the strategy for in the workforce plan really is focused on helping agencies and families recruit, onboard people. In other words, onboarding means getting the foreign patient, making sure they're right sized at their job, that they know what to do as they work, including all the paperwork and whatever, retention and ongoing training. So what are existing allocations for recruitment, onboarding, and training that are in contract? What do people get that do self-direction? Is that adequate? What's the situation with the PCA program and or continuous nursing? Pilot a regional or other employment collaborative. We have employment collaboratives to get people with disabilities working. Should we have employment collaboratives for workforce recruitments for individuals, families, and providers? When I say individuals, I'm talking about individuals with disabilities, by the way. So think about that, and some providers have big human resource teams. They might not need to take advantage of that because they're very large organizations. But there's many providers that could use this kind of collaborative approach. And of course, this is a big one, high school and college preparation for our field. We used to do it well. Commonwealth can facilitate this again. And part of that goes with a reasonable pay, right? But assuming we're going to have reasonable pay, clearly we need colleges on board, we need high schools on board, and there are programs out there, but there are just not enough of them. And especially at the high school age, we want to get people thinking about interning and working in the field. Ensure accountability. If we do figure out more reasonable allocations for recruitment and onboarding, staff training, make sure there's accountability that these funds are spent that way. And then develop career paths and consider alternative certification. Those are the four sort of areas in the workforce that we emphasize. And I'm just going backwards to show you them again. And you can see that on the page. Okay. So I'm going to hit you with the third part. And this is all about equity, the third part, which really should be the first part of any presentation about disability. Looking at recent articles and research, adults with disabilities are 3 times more likely to have heart disease, stroke, diabetes, or cancer than adults without disabilities. Transportation is the most frequently reported problem for people with disabilities. And then employers perceive more barriers for hiring people with intellectual disability and mental disorders. Those two groups specifically. And then what the article says is that actually the hiring authorities feel they automatically assume there's a lack of skills, right? So perceived lack of skills. They also worry about legal issues. If I do put someone on warning, or if I, trying to correct them in their work, I'm going to have a problem legally. It's a shame that these are the realities of the world we still live in. It's 2019. And the reason I bring these things up is equity is in our mission statement now. It's something the board embraced strongly, equity across all sectors of society. For our folks, some of them don't need a huge lift, don't need a huge amount of funding to be treated fairly and to get to the starting line in life. But others, to have them be at the starting line, they do require supports. They do require funding. They do require sometimes 24 hours, 7 days a week funding. That's just reality due to the intellectual disability, due maybe to others who may not have a high intellectual disability, but they have a significant behavioral issue. Others who may not need 24/7 help, but they have significant problems in executive functioning skills. We have to help people get to the starting line, and the ARC believes strongly that if you're going to have an unbiased society, that society has to embrace whatever funding supports that are needed. And one day maybe we won't need laws, but hopefully, right now we do need laws to make that happen. You have to advance inclusion, we believe, to advance equity. It's just common sense. You're not going to ever get to the point of advancing equity if you're constantly seeking separate but equal kinds of solutions. It's just not going to happen, because people will then, it reinforces the dynamic of they versus us. And that doesn't mean you can't, live in a house with 3 other people with disabilities, or, but what it does mean is if you set up these large frameworks that say, hey, we have to build our own little world here. And by the way, that means we'll have to keep up the yard or the grounds and whatever, what we call HOA for people that buy into condos. The HOA for people in separate but equal is pretty high, the ongoing cost and expense. But more importantly, it does work against advancing equity, because people think, well, you don't need equity. They have equity through the separate situation. So first thing we have to do is increase familiarity, and familiarity to help people appreciate that people with disabilities are just like people without disabilities, and that one day we'll all probably have a disability if we get old enough. We want to decrease they versus us, and that means we don't want to get into us, poor us or entitled us dynamic, just as much as we don't want other people to treat us as they. And then we need to speak up when we see inequity, whether it's in a medical setting or a first responder setting or education setting and a transportation setting, so we can't afford to not speak up. And the only way you can achieve a level playing field is through funding and policy, and funding and policy that advances inclusion. In the end, it's going to advance equity. So consider helping to widen the circle of inclusion and friendship. We want people to know that it's a world where we all deserve our space, help address loneliness. There's a lot of people living in the community. They're still lonely because of lack of connections. Share your inclusion stories. We want to post them. So if you can email them to us, you can do some short iPhone vlogs, video blogs. And then one option there is we have a partnership with DDS called Friends, Widening the Circle. Check out the page. There's toolkits on there about school, recreation, residential living. But really, there's many ways to achieve this. And I just want you to know about that resource as well under programs. You'll be able to find it. But we have a long way to go. We've come a long way, but we do have a long way to go. What we want to do is make sure people wanting good lives, or those with disabilities, have a voice. We want to all work together for a better tomorrow, and with civil rights for all. So I went a little quicker through this than I expected, but I had a few more things I skipped over in the budget. But you may have questions about that during the question and answer period. Kerry, do you want to manage the question and answer period and see if people?
Sure. So thank you, Leo. So just if folks want to chat in their questions to me, we can get them answered. Give it a minute.
Hello, can you hear? Can you hear me?
Yes. Is that Lucy?
Yes. I don't know how to chat. Can you? Or can I do it
Okay.
orally on the microphone?
That's fine, Lucy. Yeah. Go ahead.
Okay, so my question is, has there been thought to paying more for the direct support professionals who deal with people with the most severe issues, like severe physical disabilities, for severe behavioral disabilities? The job is harder than dealing with some people. And the lack of people who are willing to do this now is just horrible. I mean, there's just no, it's very, very difficult to get people who are willing to deal with this population. And I'm wondering if there's been some thought about having some kind of a bonus pay for the more difficult work.
Yeah, I think, that could relate to certification too, Lucy. The idea of giving people certain certification. I get your point. If you're lifting someone and you're helping them eat, and that might be more challenging. Also, we have BC in terms of the behavioral part. As you know, there's the BCBAs and what is called registered behavioral technicians that tend to make a bunch more money. And I think that's why the funding in organized programs probably has to keep better pace with that. To some extent, by the way, providers could use those programs in their programs. I don't think it's necessarily double dipping. That's something to evaluate at the agency where your son is. I'm not 100% sure about that, but in terms of a short-term fix, but in terms of a long-term fix, I think you're probably right. I think that's got to be one of the creative, we're asking really for a planning process, right, to tackle the situation. Even though we have a formal proposal, we want to share the ownership on this with stakeholders. So that would be something that'd be reasonable to talk about.
Thank
Okay,
you.
thanks, Leo. And then Diana had a question. What are you most optimistic about for the coming year?
Well, I got to say the state budget, even though we can't get everything solved overnight, to me that's what I'm most optimistic. Our legislature, I'm hoping the Senate will respond in kind, given the people in there. But the House was just phenomenal on, the passage of the budget. I do think we've got some great, volunteers in terms of the spirit for Nikki's Law and the Abuse Registry. I do think there's a lot of passion beyond tackling this workforce issue. Everywhere I go, it seems like we struck a chord. So I think there's a lot of good out there, but I would say the budget, though we still have areas where it's not ideal, right? And then the Nikki's Law, the registry, and some kind of initial solution for the workforce, some kind of step in the right direction. I feel optimistic about all those things. Clearly, we've got a healthcare for everybody today that we didn't have before. But everything's not perfect, right? And it's finding the right healthcare provider. And if we do get new money for services, can we get the workforce to provide those services? So it's not black and white; it's gray, but a lot of good things.
Okay, thank you. And from Marie, what is being done to work with employers to open up their doors to give individuals with IDD a chance to work?
Great. I think so. What's the good news on that is there's more people working today than there were 2 years ago. And this came up recently talking about, can we have a more coordinated strategy about the employment and the workforce? I'm trying to remember who brought that up recently. And so right now there's employment collaboratives that are out there. There's the Work Without Limits program. There's all these different kinds of pieces out there that are all striving for the same goal. Institute for Community Inclusion in Boston, DDS's initiative on employment. There's work, Joe Belil from Easter Seals is leading an effort around employment through contracts and state jobs. Auditor Sam Bump just did some work in that area. So I think what's probably missing is probably need to sort of think about a campaign for that. I know in our case we can only do so much, but and we've got a few other campaigns going on right now, but I do think that's a worthy area. for even a more effective campaign, given some of that research that even I was sort of shocked, to be honest with you, when I read even today that employers perceive the lack of skills as a barrier, as well as the legal risks. So with your question, you're pointing out, we just need to do better, especially if your friend or yourself or your family member is not being employed and you know they can work. It's very frustrating. The other thing I want to add is I really think a lot should be done in the school years, and Kerry, who's hosting this, is involved with DDS and a bunch of other partners that I'm not going to get into, but there's state agencies, there's ICI, there's Federation, I'm sure, there's other groups involved. And we're actually working on the family side of it more, helping families raise expectation while their kids are 14 and older, while they're in the school system. So there can be internships, volunteer jobs, paid part-time jobs while they're young, so they'll develop employment skills. And I think if this happens in enough communities, it will become commonplace, okay? Because we do, again, that 3.3% unemployment rate means workplaces are desperate for workers. And for those that can do more demanding jobs in the technical area, there's doors open in that area as well.
Okay, thanks, Leo. And then Diana has a question. Are there cities in Massachusetts that you admire for their innovative programs for people with disabilities? What are some of them?
Oh, wow. Put me on the spot. That's really hard to do. So I'm probably going to opt out of it. However, I do want to say there's some cities and towns where their disability commissions have really had an impact. I also think there's some school systems where you see it, and I'd hate to mention just one, okay, but I'm going to mention Needham, only because they embraced the transition counselor role really early when that role was developed and focused on employment and social skills and community skills. But I think you're going to have to ask someone else, because I'm so busy sometimes on the state and federal stuff that I can't to rate like how they treat adults, and there's young people, and how are they with first responders, right? It's hard for me to give you that. I can think of great anecdotes where certain cities and towns did a really nice job, and I can think of some fewer, thank God, that didn't do such a nice job. But it's so many pieces to it that it probably would be doing a disservice. But it's a great question. It's something that we should survey in the towns where we live. How are the first responders doing? How is the school system doing in preparing our young people? How inviting is the broader community when people want to get involved in civic groups? I think that's a great point, and might be something after we lick this workforce thing after 2 or 3 years. Maybe that's what we should focus on, working with communities.
Okay, thanks, Leo. And then Pam has a question, and I might be able to help answer this as well. Is there anything being done to train and support schools to promote working skills, development, and actually working in transition programs?
Go ahead.
So maybe I can take a stab at this. So myself and Marie, who just was asking a question about work, we're part of the Massachusetts Partnership to Transition to Employment, and it's a federal grant that the Department of Developmental Disabilities got to look at systems change on how we can do a better job with good outcomes for our children as they leave school. So the partnership is made up of every state agency. The schools are at the table. Amanda Green from the Department of Elementary and Secondary Education, Jennifer Stewart from Massachusetts Rehabilitation Commission, David Hoff, and a number of others from the Institute for Community Inclusion. We have folks from Mass Hires, who used to be the career centers, and Mass Advocates standing strong. So there's 4 working groups, and we have educators, we have the larger consortium of service providers, and we're all trying to talk about, we're identifying best practices and trying to replicate those in Massachusetts. So that's a little a bit about the work that's being done. A lot is being done, looking at schools, but we're all in this together. So, and I just also wanted to encourage any of you who do have transition age youth to reach out to your local Massachusetts Rehabilitation Commission. It's called their PREETS program, which is the pre-employment training services. They're now supporting July 1st. They're supporting students as young as 14. And as you know, Mass Rehab Commission, their job is to get people jobs. So they're partnering with schools to do this. So I'd encourage you to reach out to your local school system. There's a school counselor. There's a counselor in every school system from Mass Rehab, and you can find out what's going on. So I hope that answered your question. Kathy said said a question, Diana, I like your question because it helps identify the programs that are providing good models. So I don't know if you wanted to add anything, Leo, about the MPTE.
No, I think it's I wish it could go on forever, because I think with 300 plus cities and towns, it's a lot of work. It's always a crusher when somebody graduates who could have had more experiences, and sometimes a combination of the family situation and the school situation. But the schools, they struggle with this because it is different, right? It's not classroom teaching, and they have to focus and individualize, and it's great to have this program. I'm really pleased. Collaboration.
Yeah, and I would encourage, if anybody's interested, we had a great webinar with Jeff Gentry and Rosa Ortiz, and actually Jan Hollenbeck from Medford Public Schools. It's on the ARC's YouTube channel. It's called Credentials to Careers, and they outline some really great steps for some of their students and the outcomes. So if you could, if you're interested, check it out, because work's a really important part of our children's futures. All right, any other questions?
Looks like we're done.
All right, well, thank you all for joining.